Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the NARM Training Institute. I'm your host, Emily Ruth, and I'm so glad you've joined us today. Hi, Transforming Trauma listeners. We're thrilled to share with you that the new NARM book is coming out on July 26th. The Practical Guide for Healing Developmental Trauma Using the Neuroaffective Relational Model to Address Adverse Childhood Experiences and Resolve Complex Trauma is written by our very own NARM creator, Dr. Lawrence Heller, and NARM senior trainer, Brad Kammer. This book is designed to promote personal and collective change. The intention is to make NARM accessible for anyone working with or dealing with complex trauma. Using therapeutic examples and helpful exercises, Brad and Larry demonstrate how NARM can serve as a catalyst to promote healing and post-traumatic growth. Whether you are a mental health or other helping professional, or simply interested in personal growth, we hope you will find this book useful in your professional work and personal healing. The Practical Guide for Healing Developmental Trauma is available for pre-order now on Amazon and other online book retailers. Please visit narmtraining.com/books to stay up to date on the latest news, promotions, and giveaways. And now for our interview. Dr. Jena Vasquez is a licensed clinical social worker supervisor, NARM therapist, somatic experiencing practitioner, yoga therapist, and instructor. Dr. Vasquez is also the co-founder and clinical director of Inspired Practice, a therapy practice in Austin, Texas, which offers a dynamic array of services such as clinical supervision, psychotherapy, and yoga therapy for individuals, couples, families, and groups. Dr. Vasquez draws upon over 15 years of practice experience, and in this interview, we talk about the research involving complex trauma, which she conducted to complete her doctorate dissertation. Please enjoy this conversation with Dr. Jena Vasquez. I'm sitting here with Dr. Jena Vasquez. Hello, Jena. Welcome to Transforming Trauma.
Hello. Thank you for having me. Nice to be here.
We are so happy to have you. And as you might know, we're typically starting these conversations off like we would a NARM session. So I'll just start by asking you, what would you like listeners to get out of our conversation today?
Well, I'm a researcher, and I think I would start with the research. Research tells us that trauma therapists are routinely exposed to secondary traumatic stress and burnout in their work with trauma survivors. And the research also shows that there are protective factors that can help alleviate some of these consequences of working with trauma survivors. And one of them that is very frequently mentioned in the literature is training. And so what I'd like to talk about today is the fact that training, such as the NARM training, can really help trauma therapists to reduce the impact of secondary traumatic stress, burnout, and compassion fatigue that so many trauma therapists are exposed to in their work.
So important. I'm excited to dig into that. So what would you like to share with us about how you're involved in the work that you do in the field of complex trauma?
Well, I am a co-owner of a group psychotherapy practice called Inspired Practice LLC. And we provide trauma-informed psychotherapy, yoga therapy, and also clinical supervision for LMSWs that are working toward their C. So that's very exciting. I really am passionate about supporting trauma therapists and helping them to have the training and the skills and support that they need to make this career sustainable. I also teach full-time at Texas State University School of Social Work, and I teach as an adjunct professor at Our Lady of the Lake University. And that's something I really enjoy doing, again, just helping emerging therapists to learn how to develop their practice and become trauma-informed and learn how to practice self-care and let this field be sustainable for them.
I've heard you use that word twice now, sustainable, and it's really sticking out at me because I know of so many therapists who are exiting the field because of exactly what you're talking about, that if there's not the appropriate self-care and the proper training really to know how to take care of ourselves and how to practice in a way that's sustainable, it's problematic. So I'm excited that you're doing this work. Very cool. So what could you tell us about specifically the work that you're doing in the field of complex trauma? Are you mainly focused on training therapists, or I know that there's a lot lot that you do.
Yeah, so I also have my own clients. So I work with complex trauma survivors and I integrate NARM into my client psychotherapy work with them directly. And then I also support emerging clinicians and help them to learn how to support their clients.
And I'm curious how you would define complex trauma.
Yes. Well, I would go back to the work of Judith Herman, 1992. She was such a visionary.
Mm.
And Judith Herman taught us that complex trauma is prolonged trauma that results in a disturbance of self organization. And I think she's such a genius because just recently, when the ICD 11 finally published complex PTSD as a diagnostic criteria, they basically took the diagnostic criteria for PTSD and added in 3 elements of disturbances in self organization. So you have affective dysregulation, negative self concept, and disturbances in relationships. And I think that that's really where you have to start when you talk about complex trauma.
Yeah. So I know that you're NARM trained, and I'm curious around what led you to getting trained in NARM and how you use NARM in your work, because you are doing so many different things. I'm curious how you weave that in.
Yeah, well, I was working as a counseling and resource program director at a small nonprofit. I was overseeing a team of 10, and we were working with survivors of interpersonal violence. So, domestic violence, dating violence, sexual assault, sexual abuse as a child.
Mm.
And many of us became SE trained and we were using, our SE work. And what we saw was that, it can get you so far. It's great. I mean, it's really a great tool, techniques. I still use it with my shock trauma clients. And then you kind of hit a wall. My therapists were hitting a wall with their clients, and especially what we call the AMAC clients, or the adults molested as children, the clients with this prolonged developmental trauma. And we wanted to learn more. So one of my colleagues found out about NARM. And we went to an intro. Brad was in Austin, where I'm based out of. And, I went and saw him and I said, yes, I'm in. I want to learn more about this. So, quite a number of us decided to join up in the first Austin training and never looked back.
That's so cool. And I hear that there's another training coming up. By the time this airs, it might already be over, but it's exciting that you helped bring in NARM to the area. So you got trained in NARM. You never looked back. What does that mean when you say you never looked back?
I think the 4 pillars of NARM really are the framework that guide my practice with complex trauma survivors. I always start with the contract. What are you looking for out of our work together? Let's establish that therapeutic contract and use that as the thread, that you carry throughout the session. Asking exploratory questions is key. Reflecting the psychobiological shifts. I mean, that's just sometimes things the client can't see that are happening in themselves, and you can reflect that back to them. I find that to be so useful. And then reinforcing client agency, especially with complex trauma survivors. There's so much like this is happening to me, and sort of this like feeling of just being a victim of circumstance. And being able to really reinforce the client agency. I mean, Brad has such a great example where he says, you picked up the phone and called me and made an appointment, and you got in your car and you drove over here, and perhaps you got a babysitter or, took time off work or something. And now here you are sitting in my chair. Let's go. You're showing up.
That's such a good reminder. As one who also sits in the client chair, I sit in the client chair and it can feel sometimes like life is happening to me. These things happen to me. And that's so valuable to have that reflected back. So yeah, I appreciate you naming that. So you did the NARM training, you haven't looked back, but since then, since your training, you've also been involved in other things. So I'm curious how you're weaving NARM into those other ways of showing up.
Yeah, so I recently completed my PhD in social work, and I was faced with a major decision, a years-long decision, which is what do you want to do your dissertation research on? And I just knew that I wanted to study NARM. I just said, NARM is making such a difference in people's lives, and yet it really hasn't had any published research up till that point where I started my study.
Yeah.
And I said, I really want people to learn about how impactful this model has been on my life, on the lives of my clients. So I made a decision and I said, I really want to look at NARM, and I want to look at how NARM supports trauma therapists in their work with trauma survivors, because all of the research, as I mentioned, tells us this field is really brutal. And my personal experience, my professional work experience showed me that. I was, counseling and resource program director, supervising these team of 10, and just clinician after clinician came in full of hope, wanting to help survivors. And one by one, you would just see they couldn't take it. They didn't have the skills in order to make this work sustainable. So we lost really great trauma therapists, people that cared about this work, people that had a passion for doing this work. And without something like NARM to help them really structure their trainings and provide them that necessary support, they weren't able to make this career sustainable. Yet in my research, I talked to people with 10, 20, 30 years of experience who just look forward every day to working with their clients. And these are clients that have experienced extraordinary trauma. And because of their experience with the NARM training, they have those skills to make this work sustainable. And I wanted to show that. I knew it.
Yeah.
Anyone who goes through the training, learns the model, uses it with their clients, feels the difference that this model has on them. But it's one thing to know it and have the lived experience of it. And it's another thing to be able to demonstrate it and show that in a way that can be quantified. And that's what I really wanted to do. I wanted to be able to say, this is research based. And so that's what I set out to do in my study.
Oh, that's so cool. Like my skin is like tingling. I'm so excited to hear about this. And I've been so excited for this conversation because of just what you named just now. It's like to see the numbers, to like know that there's research about it is so exciting. So this is what I really was hoping you would be willing to dig into is what did you find in your research and in your dissertation? What can you share with us about this? It's so important.
Yeah, it was what I expected.
Yeah.
Which this NARM model helps improve the professional quality of life of trauma therapists. So I set out on doing an interpretive phenomenological analysis, and I based my study on the professional quality of life theory of Beth Stam. So Beth Stam developed this professional quality of life theory following 20 years of substantial research data from over 3,000 national and international studies. And Beth Stam's professional quality of life theory says professional quality of life is based on two elements: compassion satisfaction, which is the good feelings, the pleasure that you derive from helping people. So that's I'm doing some good in this world. I'm doing some good work. I feel good about the fact that I'm doing that. I'm helping people.
Mm-hmm.
And the other side of that coin is the compassion fatigue. So the compassion fatigue is made up of two concepts. One is burnout. Burnout, many of us have experienced. This is that feelings of exhaustion, frustration, anger, depression even, and then secondary traumatic stress. And secondary traumatic stress is the negative feelings that are driven by fear and work-related trauma. And that can be both secondary trauma, so hearing the stories of your clients' trauma exposure, as well as any primary trauma that trauma therapists often have. So my study went about looking at how do NARM therapists score on the professional quality of life, or the ProQual 5 scale that Beth Stam created based upon this ProQual professional quality of life theory. So compared to the population of folks working with trauma survivors, NARM therapists scored incredibly. We had, in terms of burnout, 84.61% of NARM trained therapists I studied reported low burnout. 15.38 reported moderate burnout, and zero, not a single NARM trained trauma therapist I studied reported high burnout.
Whoa.
Fantastic.
Whoa.
Yes.
I want to say that like my intuition would be in the general population of therapists, those numbers would be reversed.
Yes.
That's what I would imagine.
And in terms of secondary traumatic stress, also incredibly strong. 76.92% of the NARM trained trauma therapists I studied reported low secondary traumatic stress, while 23.07% reported moderate secondary traumatic stress. And again, not one reported high secondary traumatic stress.
Wow.
And then compassion satisfaction. So that's the positive feelings you get from working with trauma survivors and knowing that you're out there doing the good work.
Mm-hmm.
61.53% reported high compassion satisfaction, and 38.46% reported moderate, and not one reported low compassion satisfaction. So this is fantastic because this is the most positive result. Those are the mean scores. So as a group, NARM trained trauma therapists reported the most positive result possible on Beth Stam's professional quality of ProQual 5 scale. And what Beth Stam says about that score is that this represents a person who receives positive reinforcement from their work. They carry no concerns about being bogged down or inability to be effective in their work. They don't suffer any noteworthy fears resulting from their work. They're good influences on their colleagues. and they are liked by those who seek their help. So that is what collectively the NARM therapists that participated in this study, the result that they had. So most positive result possible.
Wow. It's like, again, my skin is like tingling. I'm so excited. I'm excited for people to hear this. Well, first, can we ask, how did you do this study?
So I started off by looking at NARM trained trauma therapists who were willing to sit down with me and participate in an interview. So we did remote interviews, and the interviews lasted as long as they wanted to talk. I had a semi structured interview guide
Mhm.
that was approved by the IRB, and I went from there. And some of the interviews went on, quite some time.
Yeah, because we get excited. We want to talk about it.
Yes, with the work you love. And then I also had all of the participants complete the Procol 5. So they took best damn scale. So I was able to actually quantify and say, yes, they have high professional quality of life, low burnout, low secondary traumatic stress, and high compassion satisfaction. So we were able to actually show that with the numbers. But the interesting thing was in the interviews, I was able to identify four of the most commonly discussed themes. So the themes that emerged from the study were that the NARM therapists felt that their work was more effective since they completed the NARM training.
Mm.
And that theme came across over and over again. It was expressed 40 different times, 40 independent times throughout my interviews, was that the therapist felt that their work was more effective. And I'd love to share some of the quotes if
I would love to hear them.
so I had a therapist who said, I've worked with a lot of clients who, in one session, say that in this session they've had more change than in 15 years of doing talk therapy previously.
Wow.
Yeah, it's so impactful. And some of the stories that they shared was really beautiful, talking about not only is the modality effective, but it also supports me in being able to do the work and sustain it.
That theme again, sustainability.
Yes. And the second most common theme that the NARM therapist talked about in the interviews was enjoying their work.
Mhm.
So we are talking about a profession that so many people burn out of and can't even bring themselves to wake up and get out of bed and go to work every day. Yet the NARM therapists were talking about enjoying their work. And this theme came up 32 independent times in my interviews.
Wow.
I had a therapist say, I really enjoy it when I see NARM clients on my schedule. I'm very excited. Yes.
Yeah. Yep.
I feel more joy in the work and in my life personally.
Personally, that's interesting.
Yeah.
Mhm.
Because, if you think about if you go to work and you do something you love and you can do it in a way that feels supported and positive, you're going to go home and feel more supported and positive too.
Yeah.
You're not going to come and go straight for the bottle of wine and the trash TV. You're going to come home and feel invigorated and want to, participate in your life.
That's it. Wanting to participate rather than check out because it's just been a grueling day of feeling like failure. That's
Yes.
such a difference. Yeah.
And the third most common theme also appeared 32 independent times was support for the therapist, the support that the NARM model and the NARM Training Institute provides for the therapist. 32 different times people talked about feeling supported by this model.
Yeah.
And people talked about there's no way I could have worked with this population and the number of people I'm working with prior to NARM. So not only is the modality effective, but it also supports me in being able to do the work and sustain it.
Mhm.
And someone else shared prior to working through the NARM model, I had so much compassion fatigue. It was pretty significant, enough that I wanted to leave the field at one point. And I think I probably had some vicarious trauma, quite honestly. And doing my own work and working through the NARM lens, that's not there anymore. And that is really powerful. I don't have to tell you or anyone, working with trauma is a difficult choice. And using NARM has allowed me to really stay in it without being in it in a way that's impacting myself and my ability to be there and be present.
Gosh, that's so telling. So the ability to be present without being in it and oh, wow.
So there were four themes that came out of this research. And the last theme was increased confidence. And this theme appeared 22 times. And the confidence that the NARM therapists reported, they're just talking about it really helped me a lot to feel much more confident and comfortable in working with complex trauma.
And I think that if I don't feel like I have the skills or I have the tools to be able to work with this population, there's no way I can feel like I'm successful or like I'm doing good work. So it's inevitable that one would burn out if you don't feel like you're doing good work. That seems really big.
Yes, it's so good. And, over and over again, people were talking about just feeling more confident, knowing that they have a greater understanding of why they're using the interventions that they're using and feeling more connected to themselves throughout process. It was really eye-opening study, and I'm so happy to have the opportunity to talk with so many NARM trained trauma therapists and that they were willing to share their experience with me and with all of us.
Yeah. That last line that you shared, that they felt like they were able to stay connected to themselves. I mean, again, that kind of goes back to the idea of like coming home and just like turning on the trash TV and grabbing the bottle of wine. Like that's a disconnection from self, right? Like to survive, like because when trauma therapists are just hour after hour being exposed to what so many folks are going through right now, it's almost like we'd have to disconnect from ourselves to survive that. And so I'm hearing you say that the feedback was that they were able to stay connected to themselves, and that seems really huge.
Yeah, and I'm just reminded of the 50-50,
Mhm.
that Brad talks about. It's like you're connected to yourself and you're present and you're also connected with your client. So it's so beautiful to be able to stay connected and not have to numb out
Yeah.
in order to hear and bear witness to what your client's sharing in session.
Yeah, because the clients pick up on that if we're I mean, they may not be able to have the words or know exactly what it is, but if we're having to numb out and, like, check out, how would they not feel that? Of course they would.
Right. And so much of the healing happens in the context of that therapeutic relationship. So just the ability to stay present in the space is so beneficial just in itself.
Yeah. Wow. So you did all these interviews, you got all of this qualitative and quantitative feedback. I'm hearing you got a lot of both. So then how did you analyze that?
Yeah, so I use the interpretive phenomenological analysis, the IPA method of data analysis. And what came from that is just transcribing the interviews. So I recorded all of the interviews, of course, with the permission of the participants, transcribed all of the interviews, and just read and reread through the interviews, looking for what are the therapists saying? What are they communicating about how this model has impacted their own professional quality of life? And then I use the data analysis software called NVivo. So I used NVivo to help me also identify and pull out themes that were like, what are the most commonly used keywords here? What are the themes that the therapists are saying? I was able to use that to help me transcribe and then analyze for themes. And those were the four most commonly named themes. And you can see like some people talking about 40 different times talking about the effectiveness of the work, 32 times people talking about enjoying the work and having greater confidence in the work, and 22 times people talking about the support they're receiving. So these themes were very noticeable. They came right off the page.
Wow. I'm thinking right now how I went through the NARM training really at the very beginning of my career. And so I kind of don't know much different, right? But even as I was going through the training, even though I wasn't seeing clients in the same capacity that I am now, that the shaming of myself of like needing to know, I should already know this. I should already know this. So I can only imagine being a therapist who has worked for years and feeling like enjoying the work and being able to show up in their personal life, how personal this training was for me and for anyone that I've talked to that's been through it, that seems really, really important that we're able to not only be excited about the work that we're doing, but like showing up in our own lives in a different way. I mean, I don't know how much you talked to the participants about that specifically, about the showing up in their own life of what that looks like, but I'm curious what you heard from them around that.
Well, one of the great things is the largest group of therapists I talked to had between 11 and 20 years of experience.
Okay.
So they really brought a lot of the before NARM and since NARM into
Mhm.
the
Yeah.
conversation because they really had so many years of experience before they found the NARM training as a whole. So I really invited them to share a lot about what was it like before you took the NARM training
Mhm.
and what has it been like since you took the NARM training. Trying to tease out how the NARM training specifically has impacted them. And I feel like absolutely throughout the interviews, without exception, people were talking about the positive effects, not only professionally, but also personally.
Yeah, that's what I was curious about because, like I said, I didn't have the same kind of before and after experience, and still I was feeling like this is different than before, even though I wasn't working as a therapist before, but it just felt like something has shifted in my life. What is this? So that's what I was curious to hear about. You have a lot of evidence to show that there is real change happening for them. That's exciting.
Yeah. And I think that another other thing that came up so much, and this was encapsulated under the feeling supported as a therapist, was like the inner circle and the live sessions, the demos, and things that are available to help people continue. It's like continuing education. And the research unequivocally says training is one of the most protective factors available to trauma therapists. But sadly, there's not a lot of research on, well, what trainings, right? We know training in general, but what's training specifically? And there's a little bit of research emerging around things like SE and other models. However, there really wasn't anything to say, well, like, how is NARM affecting the therapist? So now we know how NARM affects the therapist. We have real data and we're able to quantify that and qualify that.
Gosh, then there's part of me that gets so curious, like, what if we could talk to the clients of those therapists? What
Yes.
what if there were clients that had them before and after their NARM training? Like, I would be so curious what their experience was. Yeah, there's a lot there.
Yeah, and there's so many ways that the research can go, different ways to look at how NARM is impacting the therapists and the clients. I mean, I can see it in my own work, and I can see it in the work of my supervisees, and I can see it in the work of my colleagues. And I can even see the enthusiasm of the other NARM trained therapists when people ask, like, well, what kind of trainings do you recommend? Everyone who has taken NARM comes up and says, yes, take NARM.
So cool. Well, I'm curious if there's anything else that you wanted to talk about with your dissertation.
Well, I think that really is a very encapsulated overview of the results of the study. I think there's a lot to think about in terms of the application of this in practice and the way that trauma shows up in all different settings.
Yeah.
And it's not just in private practice. This is in agency work. This is in hospital work. This is in schools. And you're seeing a lot of trauma across the board. And we know that people who have experienced developmental trauma, in terms of just even looking at, experiences of childhood sexual abuse, you're talking about the statistics of 1 in 6 boys. You're talking about the statistics of 1 in 3 females. And, you look at being in a school classroom.
Yeah.
You look at being in a hospital setting, medical setting, being in almost any setting that you could possibly be in, you're going to come across people who have experienced developmental trauma. And these types of skills are really able to help people know, well, what do I do? Because coming at clients with developmental trauma in a way that you're using skills and techniques that are meant to address PTSD, it's not the same. It's not going to have the same impact.
Right.
You can't treat complex PTSD with tools that are meant to treat PTSD.
Right.
So that this is really the first modality of its kind that looks at both the bottom up and top down way of addressing trauma.
Yeah.
And I think that is really where NARM stands out. And I think that is really the place that, you can support the clients that you're going to find in any area of practice.
Yeah. And if I can just share my enthusiasm for the online basics training that NARM offers. So it's not just for therapists. The OBT training is for the teachers, anyone else, the yoga instructors, all the other fields where we're working with people with complex trauma, because it's out there. It's not just therapists that are working with it. We're, like you mentioned, the teachers, oh my gosh, what they've had to go through the last couple of years, man, it is coming out. The complex trauma is really coming out, and having some tools and knowing how to be with their students in a way that can be therapeutic. And that's so exciting to me. And so I love that this is what you've studied, and we have some numbers to show.
I spent about 7 years working in hospital setting with medical professionals who had come for addiction treatment, for addiction recovery treatment. That was kind of how I started my career. Back when I was in my MSW program, I went to work in the program where one of my professors was working. And, I really saw here are these very accomplished, very successful folks, and they got into a problem with addiction. And yes, medical work is very difficult, a lot of pressure, difficult to sustain, turning to addiction. But what I really uncovered after working there so long, and I would have clients who were local who would keep coming to group long after they were dismissed from the program. And what I found out was really what was underlying so many of their stories was trauma.
Yeah.
And thinking just about, working in the medical profession, you look at the ACEs. So there's a very high correlation between a higher ACEs score and adult health outcomes.
Yeah.
So you're talking about folks that have experienced these adverse childhood experiences, including developmental trauma, and the over representation of these negative adult health outcomes. So in a medical setting, you're routinely working with folks who've experienced lots of trauma because they're showing up there and they've got all of these complex medical needs. If you just have some training in basics, like you're talking about the NARM basics training, even for medical professionals to know how to really better support their clients, I think it's so critical.
Oh, so critical. That's right. Yeah. Well, thank you for sharing some of those numbers. And I'm just so grateful that you are in this work in this way and helping us know that what we're experiencing, what I feel like is anecdotal, as I share with friends and, talk to colleagues that have gone through this training, it's not just a few of us. It's like everyone that goes through the training has this kind of experience. At least that's what your research has shown. So thank you for that.
You're welcome. Absolutely.
Yeah. I also wondered if you could share with us if you have any personal stories of working with clients or even in your research where you were, working with clients that have been in the complex trauma realm and what their experience was, what your experience was. Is there anything you can share with us there?
Yeah, absolutely. I think that in my own work, what I've seen with my clients is just really a tremendous ability to more effectively navigate the interpersonal family dynamics where they're dealing with narcissistic abuse. And that's something that we learn about in the NARM training,
Yeah.
both sadistic abuse and narcissistic abuse. I tend to get a lot of clients who've grown up in families where they experience narcissistic abuse. And just watching the clients sort of bloom and be able to set some boundaries and navigate these very slippery slopes and these very complex dynamics in narcissistic families where there's narcissism and narcissistic abuse, finding their voice, connecting to their own agency, being able to establish boundaries, being able to come away not with that guilt and shame and, self-flagellation that can come from putting boundaries up, but actually feeling good about it, being able to share some part of themselves with their families, but also keeping some part of themselves safe in a way that feels less vulnerable and more protected while actually showing up.
Yeah.
I think it's really been beautiful to see. And I've seen it with my clients over the years, from clients at first that just would be wrecked after having to have a day like we've just had, a family holiday.
Yeah.
And the negative impact of feeling like they have these obligations that they had to uphold and not able to keep themselves safe, even as adults.
Right.
And now actually being able to feel good about their encounters with their families and owning the way that they choose to engage with the family. So powerful.
So powerful what you just said, owning the way that they choose to engage with the family instead of beating themselves up over it, over needing to set boundaries or whatever needs to happen there. Wow.
And I have a beautiful quote from one of my interviews talking about an example that I'd love to share.
Yeah, please.
This therapist said, I have a client who maybe I've been working with for about a year, maybe a little less than a year. And what I've noticed with this client is that they have increased capacity to be more connected to themselves. When we first started working together, they had a lot of judgments around tearfulness and grief and saw that would be or perceive those emotions to be weak. And now they're really comfortable and they can access those emotions with much less judgment than they had before. And I had a session with them yesterday, and they had said to me that in 30 years of therapy, they had never had a therapist support them to feel their anger and their grief up until our work together. And they've noticed such a shift within their life because of that.
Wow. It is so powerful. And I'm feeling myself get a little bit, emotional right now as I think about, our clients that experience this finally after 50 years, 60 years, that they're starting to relate to themselves in a different way. And without, punishing themselves or berating themselves or shaming themselves, they're able to have that self compassion that so many of us that feels elusive. It's like, yeah, I know I should have self-compassion, but how do I do that? And then we beat ourselves up for not having self-compassion. That's such a common experience. And to hear from the words of a therapist who's working with someone that has this kind of shift, It's so beautiful.
And you think about that client, 30 years
Yeah.
they've been struggling with this,
Hmm.
and they come to NARM, and in less than a year,
Yeah.
they've had these types of breakthroughs.
Yeah. That's really exciting and powerful.
Yeah, and another therapist was sharing with me, they said, my work is much more fulfilling and satisfying being a NARM trained therapist. It's deeply satisfying to know that I've supported someone or helped someone in a way that has the capacity to change their lives. Sometimes I feel like I would do this for free. I mean, it's so much fun. And then they pay me at the end. I think it's just, I can't believe that I actually have come to a career and a modality that is so deeply satisfying that it doesn't even feel like work a lot of the time.
Yeah. I resonate with that. I love that. I would do it for free, and then they pay me. That's amazing.
Yeah,
It's so satisfying. I so enjoy this work.
just hearing the quotes, being in the interviews, another therapist was talking about, I feel a sense of freedom. I feel like I've been given a lens and tools and interventions and a way of being that just allows me to provide something to the person in front of me that really feels different than any other modality I've ever been trained in or used or use. Honestly, I feel like I've been given the keys to the kingdom. Like I've got just even the contracting and the consent and the intentionality. It's hard to put into words how much I feel empowered. I feel like honestly, it's brought my own sense of agency more online. Like I got this because, especially with the complex PTSD and the tangential, and now I've got the contract and I can always bring them back to our patients and clients, and even my virtual private practice. It's like the level of disorganization is high. So I've got this thread now, and I can just use it to keep us on track. And it's allowed more spaciousness and confidence in my ability. NARM, just the curiosity and the inquiry, slowing everything down. It's just been a freeing way to approach this field and the craft in a different way, a more spacious way.
What a beautiful articulation. Yes, it's that spaciousness and also the focus. It's like we can bring them back to the contract. What is it that you want for yourself?
Yes.
And so there's simultaneously this focus of staying on a track, kind of like they named, but then also all the spaciousness about that, that we could go anywhere as if it's, in line with what it is that you want. And I really appreciate that.
And another therapist shared, I feel more confident in my ability to manage unpredictable situations and just kind of show up as who I am and just feel confident that I can handle this. And I know how to ask for help if I need to. And I think before I would maybe just try to solve things by myself and like internally process them and come up with a solution. But now I'm better at delegating and asking for support and being vulnerable in professional settings, which I was probably less comfortable with before. I mean, I would always be authentic and I'm good at being vulnerable if I feel like I'm in control.
Mm.
But now I feel like I can just show up not being in control and being vulnerable and ask for support. And I think that's pretty powerful because I don't need to figure it all out on my own. And I think that's the essence of being in relationship is that you aren't alone or you don't need to be alone if you don't want to be. And so I think I just feel more settled and confident in the different roles that I have in my professional and personal life. And I think this is due to a lot of the work I've done with NARM in my own consultations and learning and just practicing the model and my own self exploration and curiosity.
So many gems in there.
Um,
So many lines that just drive it home. This idea that we don't have to and we can't be in control truly in relationship if we want to have that be, a two-way street of I'm showing up for you and you're showing up for me. We can't be in control if we want that kind of openness. And so this person really named I can show up and I can be vulnerable without being in control, and how powerful that is.
Yes. And I was thinking about how they're talking about this is impacting just not only their professional life, but again,
Yeah,
going back to what we were talking about before, is the benefits of the work. It's impacting their personal life too.
in huge ways.
Mhm.
Huge ways.
Yeah, just even the way they show up.
Mhm. I could sit and just hear you quote your 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 dissertation, the quotes from these therapists that you so generously shared their experience. Seriously, I could sit here and listen and just nod my head vigorously and smile so big my face is hurting right now. But it's so exciting that you did this work and that you're sharing this with us. And so I'm curious how, the work that you've put out there, how can people contact you? And also, is there anything else that you wanted to share before we wrap up?
Yeah, I think absolutely. I'd share that there is interest in NARM across the trauma community. I was recently invited to present my dissertation research at the 33rd Annual Bessel van der Kolk Trauma Conference in Boston. So I'm very thrilled to be there and be able to share what I found with the trauma therapist community. And that's something that I'm very excited about because if people are interested in learning about NARM, people who haven't been through the NARM training, yeah, it's going to be great.
And when is that? Can you tell us the dates on that?
Sure, absolutely. It's coming up here in May. It's going to be starting on May 19th through the 21st. And my particular segment is going to be on May 20th.
Okay. So if this airs, I think this will likely air after that, but can folks get to hear that, what you're sharing there, even after the fact?
I don't know if that will be widely available. However, I will be definitely sharing my presentation.
Great.
And folks can find that on my website, which is www.inspiredpractice.com. Inspired Practice LLC is my group practice. So I will definitely disseminate the work, results of my presentation there at the website.
Wonderful.
Anybody that's interested in learning more about my group practice, please visit us, inspiredpractice.com, to learn more about the work that we're doing to support emerging therapists.
Awesome. Thank you so much. This has been so fun. I've loved hearing all of this and connecting with you, and excited to follow your work as you continue forward. And I'm sure you'll do many more things. And the NARM community, we're just so grateful to have you. And thank you so much for your time today.
Well, thank you for having me.
Thanks so much for joining us for today's episode. To find more about our guest and their work, check the show notes or visit us at narmtraining.com/transformingtrauma. The practical guide for healing developmental trauma is available for pre-order now on Amazon and other online book retailers. Please visit narmtraining.com/books to stay up to date on the latest news, promotions, and giveaways. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Tori Essex for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community, connection with you, and changing the world by transforming trauma.